We are a sick society, and we are getting sicker, it seems, by the minute. Being in Middletown, I thought I was kind of doomed with that kind of practice. We have lots of medical stuff in our community. And so the mindset in this community is medicine. If I got a problem, going to a doctor, and what does the doctor typically give to you? One of the first things they do is give you a drug, a script, right? Most of the time, it's our opinion, my opinion, that we can get along without the drug. Drugs oftentimes just masks the problem, and it's an easy way out for them because it's their standard of care. Big Pharma has made it their standard of care. And unfortunately, in my humble opinion, it's not contributing to the health of our country. Our health is going down precipitously. So my passion, my goal, what drives me, why I'm here tonight now instead of being home, is that I want to communicate this to the community. I want to bring this message, quite frankly, to your friends, your relatives, and the people you love the most, because I want to help them. It's my goal and my desire to make a difference in this community. I want to see change. I want to see people being healthy and vibrant. So, healing and life-saving, and that's what I want to do, is I want to save lives. And that's a challenging phrase for a chiropractor to say, but I am one of those crazy chiropractors that want to save lives. I think I can do it, and we're going to learn how tonight. So our objectives for tonight is we want to show you how you can get the very most out of your care here in the office, even for patients who have been here for, 100 years? Something like that. We want to shift your belief from a disease care model to a wellness model, and in the process, I want to save some lives. And I'm going to challenge you, again, to share this information with your friends and loved ones, because I want to help as many people as I can. That's my goal, that's my desire, that's my objectives for tonight. So, let's start off with the big question. What is health? So typically, when we ask the question, the answer is if I'm feeling good, I'm healthy. Would you say that's a fair assessment? I'm feeling good, I'm healthy. What more could you want? Well, we're going to see that's only part of the picture. So we define health as a state of optimal physical, mental, and social well-being, not merely the absence of disease, infirmities, or symptoms, right? So how does that work? If you have a splinter in your finger, and I got stabbed by a pricker bush the other day, and I got a boo-boo right here. It hurts. Does that mean I'm not healthy? I got pain, okay, but that doesn't mean I'm not healthy. On the flip side of that, oftentimes we hear devastating reports of friends, relatives, or just people we know that go to a hospital or a doctor with a little ache or pain or something, and they wind up having something significant or serious. The number one disease is heart disease. It's killing more and more people. In fact, if you notice by this graph from 1900s to 2001, look how far it's gone. The death from heart disease is going through the roof, and that's only a part of it. So children between the age of 2 and 15 who pass away from an accident or whatever, they do autopsies, and they're showing signs at that age of clogged arteries. Also, from 30% of the adolescents between 16 and 20 are showing signs of clogged arteries. 50% of young adults between 20 and 25, clogged arteries. 75%. So all of these are under the age of 40. You normally don't think about heart disease under the age of 40. And we're going to see how that works and how that happens. So number 2 cause of death, cancer. We're all afraid of that, the big C word. 50% of our population will be diagnosed with cancer, and unfortunately it takes the lives, 1 in 4 males and 1 in 5 females. Not a good disease to have for sure. Diabetes. This is really a pet peeve of mine. Diabetes is really a preventable disease, type 2 diabetes. It really is preventable. So between 1996 and 2003, the number of adult diabetic patients soared from 1.9 million to 13.7 million. That's incredible. 11% of adults age 40 to 59, 23% of 60 and older have diabetes. The diabetes epidemic has become so pervasive that doctors are now finding children with adult onset diabetes. And some adults who suffer from both type 1 and type 2, known as double diabetes. A totally preventable disease because sugar kills. According to the National Center for Health Statistics and the National Health Survey, the typical adult over the age of 18 has 7 chronic conditions. Different from everybody, but diabetes, arthritis, different things that happen, chronic conditions, 7 of them over the age of 18. Just showing how bad health has gotten. In less than 1 generation, the percentage of deaths due to chronic disease has exploded from 72 to 89%. That's incredible. We are living longer. Medicine has figured out how to keep us from the coffin for a longer period of time, but at what cost? We are suffering more chronic diseases than ever before. And that's my passion. That's what drives me. That's why I'm here. So where does disease come from? There's only one cause for all disease. One cause. Are you ready? Here it is. One cause. Disease comes from the body's inability to adapt to stress. That's pretty simple, right? So inability to adapt to stress. So what does that mean? You're doing some different work, you're lifting, you're pushing, you're pulling, you got a job where you lift a lot or sit a lot. Unfortunately, the sedentary worker is at risk just as much as the laborer for different musculoskeletal conditions. But over time, your body can't adapt to that stress and you get arthritis. You play sports or something like that and you do a lot of different activities where you do wear and tear stuff, and now you get a chronic disease. But there's lots of different diseases you can get from an inability to adapt to stress. But where does health come from? There's only one cure. One cure is the body is a self-healing, self-regulating organism that has the ability to heal itself as long as there's no interference. So why do we have a national health crisis if the body can heal itself? I'm glad you asked. It's our lifestyle. Lifestyle does it all. Whether it's smoking, $10 a pack, I don't understand how that even works. The food we eat, the alcohol and the stuff we drink, a sedentary lifestyle, processed foods, fast foods, along with what I said earlier about this being a medically orientated community. We have 5 Dunkin' Donuts right in here in Middletown. We got 5 of them. How many hamburger joints, pizza joints do we have? We are into instant gratification, and that goes to the lifestyle crisis, instant gratification. So there's 3 dimensions of stress. Stress is what kills us in our lifestyle. There's physical stress, a sedentary lifestyle, trauma, prolonged sitting, poor posture, sleeping wrong. All of those things create physical stress to our body. Biochemical stress, artificial sweeteners, caffeine, nicotine, and of course a processed food diet. And then we have emotional stress, money problems, anxiety. We have more stress now. We live with more stress now, whether it's physical, mental, or chemical. We're living with more stress now than we ever have before. So how does that affect our nervous system? Stress on our nervous system. Well, we live our life through our nervous system. We can't walk, talk, or chew gum without our nerves, and if we want to do all 3 at the same time, we better have a good functioning nervous system, right? All stress is filtered and processed through our nervous system. Our nervous system gets the hit first, whatever it is. When stress becomes chronic or the amount is significant, it can overwhelm our body's ability to adapt. our nervous system's ability to adapt. This is what leads to unhealthy, covert, habituated neurological patterns that creates dysfunction within our body. So what controls health? Well, it's our nervous system that controls and coordinates the function of every single tissue, organ, and system in our body. We have 3 different nerves, and we're going to go through that right now. 3 different nerves. We have sensory nerves. So when we look at the nerves that come out of our spine, there's a bundle of nerves, and there's actually 3 nerves within that bundle. One nerve conveys information about our environment, our pain, positioning. So it's called proprioceptive. I can tell where my hand is without looking because I have those nerves in my muscles and in those joints that allow me to know my position in space. We have nerves for sensory that can convey temperature, pressure, and pain. So that's the sensory part. And the sensory part, our sensory nerves, are only about 20% of the nerves that we have in our body have to do with sense. All the other nerves have to do with function, how we move. That's the motor nerves. Motor nerves are voluntary muscles. Those are nerves that we control with our brain to move our body. Those are called motor nerves, and they're about 40% of our body. It's a function that gets affected by nerve interference. And then we have the organ nerves, or the autonomic nervous system. Those are the nerves that function automatically in our body to control our blood vessels, our organs, and our glands. So what happens is we have an unhealthy neurological pattern that interferes with our body's ability to express itself and to adapt. It's our nerves that function in our body to keep us well and healthy, and it's our nerves that get impacted by that stress that we have, whether it's mental, physical, or chemical, creating this unhealthy nerve patterns. Color is bad. Green is bad, blue is worse, red is severe. So those are the things that we look for when we do our nerve scans here in the office. Subluxations create catastrophic damage to our health. It's a vicious cycle that keeps going. Subluxations interfere with our performance in every dimension, physically, emotionally, mentally. Our ability to express our health and express our human potential is affected by damage and pressure on our nervous system. Subluxations initiate the downward spiral of disease. This is a theory that was postulated by a medical doctor and posted in the Medical Hypothesis Journal in 1994. Stick with me on this. So the thalamic neuron theory was postulated that the central nervous system is involved in all disease processes. As the central nervous system not only processes incoming physical and chemical information from the periphery, that's the proprioception, the sensory part. Our central nervous system takes that information from our environment and dumps it into our body. And it also sends out physiological commands to the periphery. So that's the opposite. It goes out too. So the central nervous system carries information. It's a two-way street. Information to our brain about our body and our environment, information from our brain that's in response to the incoming information, incoming and outgoing. So inherent in its capacity to learn and adapt, otherwise known as habituate, is the central nervous system's ability to learn to be sick. That's a pathological habituation. By looking in certain deranged central neural circuitries leading to chronic disease states. These pathological habituated states can be reversed by dehabituation through manipulation, sound familiar, and modulation of the abnormal neural circuits. So this medical doctor in this medical journal is telling us, speculating, it's his theory, that nerve flow in, nerve flow out. If it's deranged, it can be affected by manipulations. Exactly what we do here. I love this. Dr. Windsor, an MD in 1927, did autopsies on like 300 bodies in an attempt to disprove wellness chiropractic. That's what he wanted to do. Unfortunately, his research showed that 96% of the diseased organs on autopsy had the nerve that controlled the function of that organ damaged. So he traced the nerve from that organ back to the spine, and he found at that spinal level, where the nerve comes out, there was degeneration at the spine and an impact on the nervous system. He also discovered the effects of the progressive nature of subluxation on the nerve and spine. Progressive nature, that's important to understand. We all know that a pinched nerve in our low back causes excruciating pain down the back of the leg called sciatica. And it's not just on and off, it's a gradation, it's a progressive disease process. So you might feel a little achiness for a while, and then after a while it gets full blown. It feels like a hot poker down the back of your leg. The question I have is, and the question that's raised by this study is, if you can have a pinched nerve in your lower back creating a sciatic pain, what about the nerves that go to your liver, your lungs, your intestines, your organs, your pancreas, and every other organ in your body that controls how your health, your overall health and well-being? Whether you'll have diabetes or not, whether you'll have cancer or not, or heart disease for that matter. So don't let subluxations get on your nerves. All right. Dr. Windsor revealed that nerve damage is correlated with 100% of heart disease, 100% of lung disease, 100% of liver disease, stomach disease, prostate disease, bladder disease. Irritation near the origin of the sympathetic nerve, that's the autonomic nerve that comes out of your spine that controls our blood vessels, organs, and glands, is sympathetic, will cause functional or organic changes in the organ supplied by that portion of the nerve supply. So what does that mean? It's going to functioning or organic. So that means it's either going to not function properly or it's going to get diseased. And here's some other studies pointing to different disease processes. So a study revealed that 42 out of 42 patients with pulmonary disease showed evidence of palpatory somatic dysfunction at the level in the spine where the nerves come out for the lung. Bladder disease, L5, a cause for interstitial cystitis, an identifiable lumbar nerve root compressed causes urological dysfunction consistent with interstitial cystitis. Ulcers. I mean, we see this all the time. Your stomach's ability to turn on and turn off those very powerful acids that help to digest your food is controlled by that same internal one-way information and then the response to it. So how many times you go into a restaurant and you smell the food, or you're home cooking, you smell the food and your stomach starts to gurgle? Your stomach's getting ready. How did it know? It knew from the smells and the sights. All right, so that's the incoming information telling your stomach that food is coming. Be prepared. Now your stomach has to get ready by being prepared and producing more acid. And then when it's done digesting, when you're finished eating, it's got to stop. Sometimes that stopping is the difficult part. Ulcers, heart disease. Unbalanced activation of cardiac sympathetic nerves play a crucial role in the pathology of sudden cardiac health. So we know that the top vertebrae in the upper back is where the nerves come out for the heart. So we see those hot spots on a scan, and we might be alarmed and say something about that. But receiving adjustments for 1 month showed a positive trend in the EKGs that were performed after that. High blood pressure is the same thing. We see this all the time. We'll take blood pressure before and after, and the adjustment actually makes the blood pressure come down. Immune function. I can't tell you how often, how many times during the winter especially, patients will say to me, you know what, I didn't get a cold this year. I'm not getting a cold this year. I always get colds. I'm not getting one this year. I didn't get the flu this year. Well, it's the immune function. Research shows that the immune system is under direct control of the nervous system. The authors summarize that subluxation can negatively affect body immune systems. And in fact, Over a 6-month period, HIV positive patients experienced a significant improvement in their blood count under chiropractic care. This one I like here, Dr. Ronald Perot, research scientist working for Preventative Medicine Institute. He studied immune systems and found that people who received chiropractic care received a 200 to 400% improvement in immune response compared to those people who didn't receive chiropractic care. That's huge. And it really does point to the effectiveness of improving nervous system function. Ear infections, 332 kids who suffer from otitis media received chiropractic adjustments. The results showed a strong correlation in the resolution of otitis media. High cholesterol. Again, all 10 cases reported marked reduction in cardiac risk factors, including during the duration of the study. This is the one I like the most. Better health with wellness chiropractic. So the first conventional HMO in the U.S. to use chiropractic as a primary care physician found that after just 2 years of utilizing chiropractic, their hospitalizations were reduced by 80%. Their outpatient surgery was reduced by 85%. And the use of prescription drugs was reduced by 56%, and this was reported in the Chicago Tribune in 2000. So the question I have is, if this is true, why aren't insurance companies and HMOs doing more to promote chiropractic? So the question is, what are the signs and symptoms of subluxation? I'm glad you asked. There aren't any, aside from what I said earlier, the sciatic pain. Okay, so that's a sign or a symptom of subluxation. But if you get something wrong with your stomach and it's not going away with Tums, are you going to go to your chiropractor or are you going to go to your MD and get drugs? Well, hopefully now you come to your chiropractor and get adjusted. But typically, traditionally, people are going to go, if they have an organic problem, a problem with their system, they're going to the MD and getting drugs. We want to stop that. So this is what we want to do. We want you to tell your friends and family to get their nervous system checked by a wellness chiropractor, get a nerve scan so we can check your sensory nerves, your motor nerves, and your autonomic nerves, just to make sure you're healthy. So here's an example of a motor nerve assessment. Again, on these studies, color is bad, green is bad, blue is worse, red is severe. So when we see all this, and black is off the charts. So when we see this thing, we know there's a problem. This person actually came in to see me with neck pain. So you can see the color here. But she didn't know that she had low back problems as well. She didn't have any pain, but she had nerve interference in her lower back affecting some of the organs that are controlled down there, and she had symptoms that were related to that. Here's an autonomic nerve assessment. Again, we look for color. Green is bad, blue is worse, red is severe. Lots of nerve interference. So the good news is, after all this, is that subluxations are reversible, absolutely reversible, especially if we catch them early. The earlier, the better. Many times, those 5 nasty words that we say, maybe it'll go away. Oh, I'm just getting older. My right knee hurts, so it's age. Well, isn't your left knee the same age? So we encourage people not to wait too long. Here's an example of a pre-nerve assessment, lots of color, and after care, practically normal. 4 months of care on this one. So, as I said earlier, I want to encourage you, I want to challenge you to tell your friends and relatives. Again, my passion is to help patients, and if you have people that you would like me to help, I would welcome that opportunity.